Okay, so hi there, good afternoon, everybody. Welcome to the webinar, Home Worker Health, Safety and Sanity. First of all, just want to take the opportunity to thank you all for taking the time out of your busy schedules to join me this afternoon. I'm going to do my utmost and my very best to avoid the use of the phrases unprecedented times, unprecedented situation and challenging period. I will try. This is mainly because I'm starting to wonder actually whether or not there ever was a different way of opening a sentence or starting an email. I do genuinely, however, want to extend alongside a warm welcome and thanks for joining on the webinar. A sincere hope that you yourselves are all safe and well, and the same can be said. For your families. For those of you who don't know me, I'm Chris Walker. Head of Health and Safety at ATG Health and Safety Consultants. You should be able to see me on your screen alongside the slides at the moment. As we move into the next slide, you will see the impact of me not having access to a barber for quite a while, and what that's done to both my beard and my hair and its current status when you see the picture on the next slide. I think, like many, my hair is longer and grayer than it ever has been before. But as I said, I wasn't going to mention unprecedented times. So I'm an experienced occupational health, safety and environmental manager and health and safety consultant. I've worked in a broad range of sectors, including waste management, manufacturing, facilities management previously, before becoming a health and safety consultant. But what I really need to point out is that I am much nearer 40 than 20, and as such, definitely couldn't classify myself as having any firm grasp over the technology that is broadcasting this to you all today. So massive fingers crossed that everything runs to plan. So I'd say you should be able to see the slide deck in front of you. You should also at the moment be able to see my face, but that will you'll be pleased to know dip out at some point and then return a little later on. I would like to just draw your attention to the Q&A function you should have on the screen in front of you. If you do have any questions for me based on the content or the wider subject of health and safety management for home workers, or anything else relevant to the content of today's discussion, please do raise those using the Q&A function rather than the chat, just because they're easier to see and to manage and make sure you get a response. I'll set some time aside at the end of the session to address those questions. Feel free to pop them in at any point or wait until the end. It's entirely to what suits you, but I will, as I say, set some time aside to address those questions specifically at the end of the session. Okay, so let's get stuck into to home worker health, safety, and sanity. So as I mentioned to you, I'm head of health and safety at ATG Health and Safety Consultants, which is part of the Napthens Group. And I would just like to start with a brief overview of who we are at ATG and what it is that we do. We're a team of health and safety consultants, health and safety professionals based in Preston. We deliver health and safety support services to organisations throughout the UK, mainly in the North and Northwest. And our consultants come from a broad range of backgrounds and experiences. We've got a variety of sets of expertise and skill sets. And what we like to do is look to partner those skill sets and sets of expertise with organisations that we believe will benefit most from that expertise, will bring the most value to that business in supporting its development and implementation of an effective and compliant health and safety management system. So I've made mention of a few of our health and safety services on the screen in front of you. Amongst the range of these services, we offer consultancy in fulfillment of the role of competent person for organisations that require it. We provide health and safety policy development and implementation support. We will audit organisations in order to establish health and safety management systems and legal compliance gaps, as well as providing solutions to helping organisations close those gaps. We provide a range of risk assessment services, carrying out risk assessments for our clients, fire risk assessments, manual handling assessments, workplace noise surveys and risk assessments, to name but a few. In addition to delivery of our own training and development where requested of bespoke training packages for our clients, we also offer IOSH accredited courses, including managing safely, working safely, leading safely, and managing occupational health and well-being. To supplement all of this, we've got an extensive e-learning offering, which covers a wide variety of employee training requirements. To sum up, our focus is to provide tailored, client-focused and innovative health and safety solutions to support you to providing an effective health and safety management system. So to move on, obviously in recent weeks, the demands on all of us within our organisations have changed. Events have created for our clients and for the rest of the UK and for us countless challenges. Throughout this time, we've been doing our best to work closely with our clients to provide advice and guidance on navigating through the crisis. Obviously, the situation has been rapidly evolving and has needed everybody involved in all aspects of the business to react quickly in order to provide timely advice and information. Throughout this period, we've also, as ATG, had the benefit of drawing on the wider support from the Napthens teams of experts, particularly in cases of employment law situations, as obviously they have been of significance throughout these times as well. Our main aim is to make sure that our clients have been well equipped and kept up to date with the evolving situation, and wherever possible given practical tools and solutions to implement in order to find a way through. We've been providing email updates, guidance notes, template and risk assessment guidance, certainly for those organisations looking to continue doing business throughout this period, and those looking to return to work in a safe and effective manner. We've kept up to date a website, a COVID-19 coronavirus business hub with Napthens, ensuring that everybody has access to the latest information and guidance from a wide range of experts. One of the key developments throughout this time has been the development of our home worker portal. So what we have developed is a system that allows management and remote communication, remote risk assessment and self-assessment and training of employees thrust into the home worker situation where they may not have been in it before. Obviously today we're on a webinar. We've been delivering as a business webinars and question and answer sessions on the hot topics as we've progressed through the crisis. And you'll see that today, looking at the graphic on the right hand side of the screen, is the first of our health and safety advice specific webinars as a business. Obviously today's the 30th of April already, incredibly, and we're looking at working from home, the risks and responsibilities around that. In the 14th of May, we'll be looking at how to continue business throughout this period in light of government guidance at the time, but also ensuring that health and safety doesn't slip down the priority list while focus is on responding to an evolving crisis. And then on the 21st of May, we'll be looking at what you need to do in terms of getting back to business safely, making sure your action plan is in place and all of the key health and safety elements have been considered as you prepare your facilities, factories, offices, and also your people to return to work. Specifically on home worker health, safety and sanity, what I wanted to do today is give an overview, first of all, of the challenge of the state of play with regard to home workers, really considering the question, is this a new challenge? Is it something that's short term or something that actually should already have been on our agenda as business already and will need to stay on our agenda for the future? So are we just dealing with a short-term crisis and therefore we need home workers, or is home working more prevalent than perhaps we realised? We're going to look specifically at your health and safety duties and responsibilities, your duty of care to your employees and others who might be affected by your work activities, and what you can do to fulfil those specifically in a solutions for home worker management situation. We're going to look briefly at mental health considerations. What we're thinking about here is whether or not the current necessity for increased amounts of home working and overall home working in general gives rise to additional mental health or mental ill health risk, and what you as a business must do and also can do as part of managing that. And as I said before, at the end of the session, we'll hold a bit of a Q&A, anything that pops into your mind as we work through the slides, but also anything that you may have brought with you to the session that you needed answering. We'll deal with those at the end. So you'll all be fairly familiar with the image on the screen in front of you. If you haven't seen it, then I don't know where you've been. But the number one topic on every news channel, every website, every conversation begins with it. I was about to say around every pub table in all of England, but obviously that's a bit of a dated reference now, isn't it? So the number one topic on everyone's lips is coronavirus. You will have seen the image on the slide before you, and you'll most likely have been impacted in some way from a work perspective by the measures introduced by the government to prevent the spread of coronavirus. But you've also almost certainly have been impacted personally in some manner by the situation. So you'll be familiar with the message of stay home, protect the NHS and save lives. You may well be one of the many thousands stood on your doorstep showing support for essential frontline workers tonight. The message to business is relatively clear. If you can work at home, you must work at home. Only go outside for food, health reasons, or work is the message that we've been given, but only if you cannot work from home. So what does that mean? It almost certainly means that management of home workers is a consideration for a huge number of organisations, and in many cases where it would not have been an issue before. But as I alluded to on the previous slide, home working isn't exactly new, is it? So are we behind the curve a little bit in terms of generally managing home worker health and safety? And is it just the fact now that actually the huge proportion of people thrust into that world has brought it to the top of the agenda? You've got some statistics in front of you. So we take a look at those and what they tell us about home working in the United Kingdom. So these stats are Office for National Statistics numbers. They're taken pre-lockdown. So we're looking at the period January to December 2019. Of the 32.6 million people at this point in some form of employment, we've got 1.7 million reported themselves as mainly working from home. What's more telling is the fact really that 4 million of the people questioned from the survey reported having worked from home in the week prior to the survey having been undertaken. And just under 9 million overall said they had worked from home in the period January to December 2019. So if we think about that as, yes, less than 30% of the eligible population of those in employment within this survey, we think about the types of work that people actually do, the sectors with huge swathes of employment, manufacturing sectors, some of the food production, construction, very little of that can actually be done from home. So a huge portion of this number of employees in employment couldn't practically work from home anyway. So the fact that a third of overall eligible workers or employed workers overall have done at some point suggests that of those that can do, a great number already do the working from home. The numbers are increasing year on year, and obviously as business sees the value and opportunity presented by home working in a number of sectors, and as technology improves, that number will continue to rise, it's suspected. But when you take into account the year-on-year rise in the number of people working from home, and look at the arguable point that the biggest risks to home workers, or most commonly occurring risks to home workers, are those around ergonomics and mental health considerations and implications, This, in theory, gives us a growing population exposed to hazards that have a potential to cause conditions such as musculoskeletal disorders and stress, depression, or anxiety, which between them already account for 80% plus of work-related ill health cases in the UK, and more than 80% of all ill health cases which result in lost working days. So we're growing a population that could be, if not managed properly, exposed to certain hazards that give rise to conditions which are already amongst the most prevalent causes of work-related ill health. So definitely something to think about as that population grows. What impact, if any, will that have on the overall numbers of work-related ill health cases? When I set out to present this webinar, I wanted to really make sure that we were all singing from the same hymn sheet when we spoke about health, safety, and sanity. I wanted to make sure we considered all of the key areas of importance in relation to worker management, and also then look specifically at what this means to the home worker. In order to meet our legal obligations, and further than this, our general duty of care to our people, to our employees, we obviously need to consider all of the factors: their health, their safety, and their sanity. They each do stand alone and require some consideration. From a health perspective, we need to look at our work, the work that we give our employees to do, and how that could impact their existing health conditions. So if they have an existing health condition, is the work that we're asking them to do, or the way in which that work is conducted, detrimental to existing health conditions? And also, does that work, or the way that that work is carried out, create a risk of ill health being caused? So we need to consider the impact of health on work and work on health. We need to look at safety, ensuring work does not present a risk of injury as a result of an unintended interaction with a hazard. Okay. So making sure that accidents don't result in harm. And the final piece is the sanity part of the puzzle. So when I say sanity here, I'm really talking about preservation of sound mental health, or good mental health. We want to ensure that the work we give people does not prevent them, or the way the work is done does not prevent individuals from maintaining sound mental health. And perhaps in the context of the home worker and the current situation, that the work and the way that the work is carried out doesn't actually cause mental ill health itself. We'll next look at what actual legal considerations apply in the home worker setting. So we've defined the health, safety, and sanity aspect, but when we're looking at legal requirements of managing health and safety specifically, what are we required to do? A number of you will be more than familiar with the regulations that we'll talk about on the next slide, but may not have considered their application to the home worker, may have in some instances disregarded aspects. There is often a feeling of out of sight, out of mind with a home worker, and sometimes the workplace situations that we're well on top of within our facilities, within our factories, within our offices, all of a sudden go out of the window the minute people leave the building, and we rely on them to work from home. We're going to touch next on some of the key statutory obligations as employers, and again stress that they apply to your home workers as well as they do to those who occupy your buildings. So looking at employer responsibilities, and we won't forget the employee as well, we will pluck some employee responsibilities in here where appropriate. But looking first of all at employer responsibilities. The Health and Safety at Work Act 1974 is something that you may well be in tune with already. The key responsibility here for an employer is to ensure, so far as is reasonably practicable, the health, safety and welfare at work of all employees. This applies to your home workers as well as it does to anyone within your workplace. It also applies to those others who may be affected by the work or the work activities that are being carried out. So if this applies to your home workers, does this also apply to others that are within the home that they occupy at the time they're carrying out the work. And finally, to mention here under the Health and Safety at Work Act, employees have specific duties and are responsible for taking care of themselves and of others that might be affected by the things that they do and don't do at work. They're also required to cooperate with their employer, to do the things that their employer has set out, to use the tools the employer has provided in accordance with the way that they've been trained to do so, in order to make sure that the employer can fulfill their responsibility of keeping them safe. The management of health and safety at work regulations, it would be flippant to sum them up in one sentence, but ultimately they require us to understand the hazards in our workplace. They require us to undertake a suitable and sufficient assessment of the risks to health and safety faced by our employees at work. Do you need to do a risk assessment for home workers, as you would for workers in your ordinary workplace, in your factories, offices, warehouses, etc.? Yes, you do. A suitable and sufficient assessment of the risks to health and safety faced by employees at work. They may be at home, but they are at work. And finally, from the screen before us, the DSE regulations, the Health and Safety Display Screen Equipment Regulations 1992. That requires us as employers to analyse workstations, assess risks, and reduce risks to the lowest extent reasonably practicable. So dependent on tasks and situations, specific roles and responsibilities, regulations that have been made under the Health and Safety at Work Act will apply to home workers. The list that I've presented on the screen in front of you are probably the ones that are most pertinent to the current state of the nation in terms of home working, but it's not a complete list by any means. The majority or huge number of regulations made under the Health and Safety at Work Act will be applicable to those working at home as they are to those in the normal workplace under normal circumstances. So this could also include the manual handling operations regulations. It could also include, and certainly does include, in most cases, the provision and use of work equipment regulations. And finally, the control of substances hazardous to health regulations are also of relevance. So the standard processes, risk assessment approach, control measures that you implement in your workplace just by taking that activity out of your normal workplace does not reduce your requirement or your obligation to maintain those measures and controls so far as you reasonably practicably can, of course. So if we talk about planning for home working and what is required in the lead up to a period of home working, or when setting out to establish whether or not home working is a viable option. Now at this point, it wouldn't be appropriate for me just to continue that sentence without stopping and saying, obviously, the current situation with regards to coronavirus has led to obviously decisions having to be made quite quickly. And some of the normal processes and practices around planning for a change or an organisational change of substance, like moving all of your employees into home working, some of those steps won't have been able to have been followed or won't have been considered due to the pace at which the change was required to be implemented. So we're very much at this point talking about a normal situation in the first bullet point, evaluating the task, but to some degree this will happen and will have happened in the coronavirus case as well. So before allowing employees to work at home, you need to look at the hazards and risks of the tasks that are being considered for home working. I've provided two relatively flippant examples on the right-hand side of the screen to differentiate between tasks that can be carried out at home and tasks that can't. On the right-hand side, we have somebody who writes work from home in their notebook. I'm not sure that's the most productive activity for them to be carrying out, but clearly they're using a computer, they're using a notebook and pen. That kind of task is, with modern technology, relatively easy to facilitate at home. Equipment, systems and processes can be taken into the home setting relatively safely to allow that individual to remain at work while remaining at home. Obviously, in the bottom corner, we've got somebody shredding waste materials. It is very unlikely that that shredder operator is going to be capable or able to be working from home in their normal capacity. It's very unlikely that you're safely going to be able to move that mobile shredder to somebody's front driveway and allow them to continue shredding wood in a residential setting. So think about the tasks. They won't all be as black and white as that one there, but can the task be carried out at home? Does your business have equipment, systems and processes in place to facilitate that home working? Remembering that as an employer, you're responsible for the health, safety and welfare of your employees so far as is reasonably practicable. You must conduct a risk assessment at the beginning of home working and ensure that it's reviewed periodically. You've got to make sure there are processes in place to ensure that hazards and risks are identified and assessed, and to seek professional guidance and competent advice where you don't have that facility within your organisation. You must also remind employees of their responsibilities, ensure that they're trained and have been given the appropriate advice and guidance in not only the work activity, but also the additional risks of carrying out that work activity in the home environment. So we've asked, can the task be carried out at home? We've then looked at the home worker risk assessment. You're going to identify hazards, evaluate risks, look at what has been done to prevent harm. So what control do you already have of that hazard? And does anything further need to be done? In the home worker risk assessment, at the point anything further needs to be done, action will need to be taken. And it's likely, due to the fact that the premises or the specific environment in which the individual works will not be directly under control of the employer, that this action will need to be taken in collaboration with the employee. Where any such risk assessment is undertaken, hazards are identified, risks are evaluated, and action is taken, you must ensure that this is documented and periodically reviewed. In identification of hazards for the typical home worker situation, the most prevalent, certainly within normal situations, will be those associated with the use of display screen equipment. And certainly during this time where we are encouraged to work away from our workplaces, a vast number of those who can work at home will be those who have jobs that require them to use display screen equipment. We need to consider the hazards from use of electrical or any other work equipment that has been provided. We need to consider our home workers as lone workers. Think about the lone working elements of their role in this risk assessment, and are there any additional control measures that we need to consider to manage that risk? It's important to remember that not all home workers work at home all the time. Some may just use home as a base. So if we've got a lone worker that's just using home as a base, where are they going throughout the day, and what mechanisms in place do we have to ensure the safety while they are, for example, visiting clients, attending meetings, training, etc. What measures do we have to ensure that their safety is looked after during that period? And also manual handling. Home worker hazards, we may need to consider manual handling, certainly in the instance that you supply employees with heavy equipment for the purposes of home working, where we require maybe extensive files, etc., to be carried home, to be worked through. We might need to consider the manual handling aspects as well. So DSE, use of work equipment, and particularly electrical equipment, is common. Lone working and manual handling need to be on our minds from a home worker risk assessment perspective. So brilliant. I've just given you all a load of work to do. So yes, a home visit for every worker right now. Really, let's get that started. Some of the issues that leap to mind when you're faced with what I just outlined on the previous slide are in front of you right now. These are some of the questions that I've answered and been asked over the last few weeks in order to help and guide clients on exactly what their roles and responsibilities are. Now, presented with the thought of having to do a home visit for every worker, sending somebody around everyone's house to do portable appliance testing, building small extensions and providing extensive office furniture, all may well lead to you wishing to pick up a branch and beat your car in a Basil Fawlty style, or it may even be me that you choose to beat rather than the car. However, don't worry, it is not that complicated. We remember that we have to look after the health, safety and welfare of our employees. Remember that that is so far as is reasonably practicable, and notwithstanding the fact that reasonable practicability may be a point of discussion from a legal perspective due to the current restrictions, there are anyway ways in all circumstances of managing home working safely and in a compliant manner without needing to panic about all of the above. There is absolutely no need to panic. What I did think about was, although it would be entirely unnecessary from a health and safety point of view in most cases, and questionable certainly from an employment law perspective, the installation of CCTV, would that have productivity improvements? There's a question for you all to take away with you. Seriously though, what must we actually do? So what must we actually do? The key points here. We need to provide information and guidance to workers on the hazards associated with the home working they're doing. If trained and guided to do so, there's absolutely no reason why an employee cannot self-assess the hazards and risks of a home working environment. You may provide them with a risk assessment or checklist for them to complete, which allows them to identify hazards relating to their activities. It will allow them to identify any additional people who might be harmed and how they might be harmed, give them the opportunity to assess the risks, and then you'll work with the employee to eliminate any hazards that aren't adequately controlled or identified and uncontrolled, or to reduce them so far as you reasonably practicably can. When we talk about risk assessment and recording risk assessment, it is important to write down the risk assessment once it's been carried out. It's a legal requirement where you have 5 or more employees under the Management of Health and Safety at Work regulations, but it is good practice in all situations to do so. Once you have encouraged your worker to do this self-directed checklist, this self-directed assessment of the activities in their workspace, and you've worked with them to resolve the issues identified and manage those hazards, you need to make sure that it is regularly reviewed. As well as considering the physical aspects of the workspace and the work equipment that are provided, you need to also consider some other aspects that won't be necessarily relevant in all home worker situations, but would form part of a risk assessment under normal circumstances and shouldn't be excluded from consideration in a home working risk assessment. These are things around training and qualifications. Certainly when we talk about home workers and the use of display screen equipment, have we provided adequate training and information on the software that we expect people to use, on the systems we expect them to use? And certainly when we talk about the mental health considerations a little bit later on, inadequate support and guidance from IT systems is probably something that I've heard more about than anything else in recent weeks, and the stresses that can cause workers who aren't necessarily comfortable with all aspects of information technology, but have been thrust into a world of home working where there is not always adequate support. We need to consider the suitability of any equipment that we provide, and make sure that any safety equipment that needs to be provided is provided. We'll ask the employee questions about suitability of the environment. We'll need to make maintenance arrangements, and think about how we're going to monitor and supervise the employee where that might be necessary. Note, it is really, really important to, when providing work equipment in all situations, not just a home working situation, to ensure that equipment provided is fit for purpose and adequately maintained. It's the right tool for the job, it's in good condition, and the employee has been trained and instructed on how to use it. The employee should be aware of the hazards and issues associated with using that work equipment, and you should review that periodically. From an employer point of view, and definitely in the home working setting, what is an important note is that you're only responsible for the equipment that you supply. So where you supply work equipment for use in the home setting, you are responsible for that equipment, but you're not responsible, for example, as you would be in the workplace, for the domestic electrical system. So you're not responsible for ensuring that the socket your employee plugs their laptop into is in fit condition and is safe to use, but you are responsible for ensuring the equipment that you provide is. However, it would be good practice to make sure that your employee is aware of the types of issues and hazards to look at, even in their domestic system, so that they know what to avoid. You can avoid a situation arising altogether. So we've provided information and guidance to the workers. We've encouraged them to do a self-assessment checklist, and we're going to work with them to resolve the issues identified. Ensuring the work equipment we provide is safe when it's issued. We train our workers, this is really critical, we train them to identify defects. Let's not assume automatically everybody knows what the insulation is for on the outside of an electrical cable. Let's make sure we draw attention to the key features of the equipment that we are providing and what to look for in terms of deterioration and damage, and what would make that equipment unsafe to use. We're going to give a mechanism to the employee to report any defects and give them advice on maintenance, cleaning, and care of the equipment that we've provided them. And of course, throughout the entire home working period, we're going to regularly monitor the situation, review the measures that we've put in place, seek feedback from the employee on any new issues that may have arisen, and make sure that we correct any issues that are identified as we go along. So the process flow diagram on the right hand side gives that overview in a real simple setup for any organisation to follow when considering home working, and making sure that all of the obligations have been ticked off. Assessing the individual home working arrangements, providing the work equipment where it's necessary, instructing them how to use it and how to set up a workstation correctly, providing them with emergency contact information, regular reviews of the arrangements, monitoring and checking in with them routinely, and reviewing the working from home arrangements regularly as well. So when we start to look into the specifics of display screen equipment within the office environment and within a typical workplace, the knowledge and application of the display screen equipment regulations is usually very, very good. It's something a lot of organisations are very aware of the need for various measures to be in place, aware of the need for workstation assessment, information, instruction and training of employees. But not all organisations are used to having DSE users. It may be that in some cases we've got a new DSE user who was previously doing something different in an organisation who is now working from home fulfilling a different task. It's worthy of note that the HSE state that there is no increased risk if home DSE use is temporary, but that home DSE or display screen equipment use on a long-term basis requires risk control, including a home workstation assessment. Critical is that there is no definition of temporary or long-term. So it is wise to take the approach of attempting to control the risk, whether the work is temporary or whether it is long-term. Those responsibilities or those actions include provision of information on the workstations and DSE hazards, asking employees to self-assess. Again, much like the general home worker situation, use a guided checklist, ensure employees are trained, given the right information to be able to carry out that checklist, and then as an employer, work with them to act on the issues identified. We're going to encourage and facilitate safe practice. What does that look like? Ensuring we've given that information, instruction and training. We've gone through workstation setup with our employee. We've highlighted the key hazards, things like lighting, screens, glare, the height of the screen, additional devices like keyboards, the chair that they're using and the workspace in which they operate. From a DSE perspective, I would personally say that my practice at home has bettered what it does in the office, simply because I find it easier to break up long sessions. I will stand up and walk around the garden while on a phone call, which isn't always practical in the office. But it's important to remind employees that breaking up long DSE sessions is really, really important. Regular breaks. Get employees to avoid awkward static postures and ask them to get up, move and stretch. Sanity. From a home worker mental health perspective, I just wanted to revisit the employer's legal duty. So we discussed about the need to assess risk and take care so far as is reasonably practicable of the health, safety and welfare of our employees. It does, of course, include mental health. Mental and physical, is an aspect that is considered within the Health and Safety at Work Act and the regulations that fall beneath it, including the Management of Health and Safety at Work regulations. So in our home worker risk assessment, have we considered the factors that give rise to a potential for increased mental ill health for home workers? Just highlighted some of the issues that may contribute to that increased risk for home workers. The environment that they're in may not be conducive to the type of work that they're trying to carry out. They may have others around them. Certainly now we're all thrust into this home working situation. We may have others around us. We may have children around us, and we may be trying to juggle all of those aspects at the same time. I have a bulldog that doesn't really appreciate me hosting webinars, so has had to be locked in the spare room. So I'm undoubtedly likely to return to some form of protest or other placed in that room. The lack of routine, unhealthy habits. I hold my hand up. My alcohol consumption has increased a small amount during the lockdown. There are interruptions, existing home conflicts and stresses and strains that are going to be exacerbated. Key really is a lack of communication, understanding what an individual is meant to be doing, how the business is doing, are they fulfilling their objectives? The normal feedback loop with managers and colleagues is interrupted. So external factors as well, obviously the concerns and anxiety around the actual currently evolving crisis, concerns around the health and safety of our families, the security of our jobs and finances are all going to contribute to this increased mental health risk for our home workers at the moment. And when we throw that into the mix with the pre-COVID-19 picture, work-related stress, depression and anxiety were already major workplace ill health concerns. And if we have a large population now that's thrust into a situation more likely again to give rise, it just points out how careful we really need to be in terms of managing mental health, how conscious we need to be of mental health and work-related stress from a home worker perspective at this point. From an action plan point of view, in terms of mental health, we're going to consider, when we do our home worker risk assessment, the stress and mental health considerations. And the types of controls that we might implement are relatively simple. We might share calendars and diaries with our teams, making sure that we set clear expectations, but maintain flexibility and realistic demands. What is normal productivity at the moment for somebody who's never worked at home before, where our organisation is performing its duties differently, delivering its product differently? What does good look like from a productivity point of view? We need to make sure, yes, we set clear expectations and our employees are aware of what they need to be doing, but also that we have an understanding and a flexibility and a realism about the ability they have to achieve those demands in that home working environment. As managers, we must schedule times to talk and communicate with our teams and facilitate working amongst those teams. So whether that is through holding regular phone calls, whether that's sharing emails, whether that's using Zoom, Microsoft Teams, whatever the tool is, facilitate in some way of your employees still working together, and ensuring that everyone is aware that the lines of communication are open. What mechanisms for communication are there? Who's still in the business? Who's working? Who needs to know what, when? Making sure that those clear lines of communication are open so people aren't left uncertain on any aspect. Encourage employees to define their work, non-work and rest time. Ensure that they set up where possible a designated separate workspace. Encourage them to get dressed. I've struggled with this one myself. Encourage them to get dressed. The mindset change of getting up in the morning and getting dressed and not doing your day of work in your pajamas every day certainly does make a difference. Encourage everyone to contribute to team communications and look out for those who aren't contributing to team communications and explore if there is an issue, if there is a reason why they're not engaging with those team communications. And encourage everyone to speak up with questions or concerns, but never assume that just because somebody isn't hitting you up with questions and concerns that they don't have any. So be proactive as a manager and engage with those who you may have concerns about. To finish on the mental health side of things and the health picture overall, staying physically healthy is really, really important. We talked about ergonomics and display screen equipment and the risk of musculoskeletal disorders. Physical health and activity and mobility is important in staving off those issues to a degree, but also has an overlap with your mental health situation as well. So staying physically healthy, ensuring that we encourage employees and we ourselves eat healthily. I originally wrote drink plentifully on there. What I meant was lots of water. So I've changed it to drink healthily. Making sure we feed and water ourselves and fuel ourselves properly. And we exercise. We take the opportunity to exercise in whatever form that can take with the restrictions as they are at the moment. And all of that will help us sleep healthy. And if we're sleeping healthy, we're going to wake up healthier. We're going to feel a lot more capable of handling the demands of the home working environment. I just wanted to throw forward really to draw further on that subject of certainly eating healthily and exercising. My colleague in People Projects, Jenny Hayes, who many of you may have met and seen present webinars previously, has a really exciting and interesting sounding webinar on May the 5th, which is about maintaining well-being and mental health during the pandemic. Some really interesting speakers on that particular session, and would give an opportunity for us to draw some inspiration for tools that might help us manage through this situation. Okay. So that draws to a close the content that I had prepared for the session. Thank you very much for listening throughout. I am going to pop the video back on, so you should all now be able to see me, and I'll start to have a look at the questions that have been presented. So if you just bear with me 1 second, I'll just have a look what questions that we have. Okay, so Gary Butler, thank you very much for your question. Is it acceptable to ask an employee to use their own equipment for home working, e.g. a personal laptop? First part of the answer to that question is I'm currently using my personal laptop. That's just out of preference. I think at the bottom of the question really comes there. You can't force an employee to use their own equipment for home working. It's your responsibility as the employer to ensure that they have the tools at their disposal to carry out the work. But there will be situations in which it's appropriate to collaborate with them on that solution. And using personal devices and equipment is often a part of many organisations' sort of IT strategy anyway nowadays, as long as they are operating within the within the confines of whatever security protocols are in place for the organisation, etc. I'd suggest, Gary, that it's acceptable to ask them perhaps in the short term, but that isn't a solution to the problem overall. I.e., to give them no alternative, I think wouldn't be acceptable. So I hope that answers that one for you. Gary Homan has asked, would it be reasonable to expect an employer to assist with electricity costs, etc.? As I understand it, Gary, there is no obligation on part of the employer to contribute. However, it may be something that in a long-term home worker risk assessment, particularly where the equipment that you were provided, in a long-term home worker arrangement, not a risk assessment, where the equipment you're providing is likely to consume a great deal of electricity, that you may wish to consider that as part of the package for that home worker. But certainly in this current situation, there is no obligation for an employer to actually fulfil the electricity cost associated with using the equipment provided. Jane Gore has asked if we have examples of home working risk assessments that can be used. Absolutely, yes we do. Yes we do. That's something that I'll have a chat with Wayne on, who's hosting or assisting with hosting of the webinar, on how we can send out some examples to those that have attended the session today, Jane. So I hope that helps. So just going to read this question. Just bear with me a moment. Okay, so there's a specific question with regard to an employee who's currently working from their bedroom, and working from the bedroom is giving them serious issues. So in this case, the employer has offered to purchase a desk, but he says he has no room for it. And with 2 young children, can only work from that room. Is there anything else we could suggest to help him? I think in response to that particular question, absolutely, there are additional things. It's difficult without knowing the specifics of whether there are any pre-existing health conditions and what the current workstation setup is in that bedroom. But ultimately, we should be encouraging the employees and facilitating, where possible, the use of an improved setup where that is the case. I think with that particular question, so Mary Treadwell, if you like some specific advice on the individual case, then contact me directly, and I'll see if I can advise. Might need a little bit more information about the individual in order to advise best there. So, okay, someone just asked for a copy of the slides sent via email if possible. Again, I'll defer to my technological expert on that front, who I think as a minimum the webinar will be recast, available to rewatch. But I'm sure the slides may be made available as well. But I will leave that to my colleague to confirm. Here we go. So Nicola Croft, do we have a responsibility to ensure good DSE setup, especially if they don't have a desk to use? So you have a responsibility to ensure that your employee is aware of what a good desk setup or what a good workstation setup is. The DSE regulations don't specifically require you to provide a desk. A table and chair could be suitable as a workstation if set up appropriately. So you have the responsibility really to advise and inform them on what the situation should be, and then if they can't reach a satisfactory situation in the short term during this period, then to investigate what you can do more in order to help facilitate that, Nicola. The questions are jumping around on my screen, and my eyes are following them. So Nicola Cornforth, thank you for your question. My company are big on supporting mental health now more than ever. Are there any good websites or charities we can point our employees to? There absolutely are, Nicola, and the exact URLs do not leap to my mind at the moment. But there are a number of tools. Obviously, Mind, as a mental health charity, have been doing a fair bit of work on supporting this in the background. So with a Google of those guys, that will probably give you a link to some useful support. And when we follow up on this webinar, I'll see if we can include some additional links, as there are a number of local and regional charities and websites that do work on supporting mental health, Nicola. So absolutely, we could provide some further information for that. I'm just going to have time to pick up one more question before we close the webinar. Anybody who have not addressed your question directly, I'll contact you outside of this. So just mark that one. Okay. So how often would Gary Homan, again, thank you very much, Gary, for your question. How often would contact of an employee be recommended? Issues could arise of daily or multi-daily calls, can be seen as stressful and overbearing. That's a really important point, Gary. And that's one I've sort of challenged myself on as a manager. I was, if anything else, as a manager of people in the first instance, once the team were remote, I was probably overbearing. That's a good word for it. In just constantly trying to keep in contact. I think really the key is agree that contact and communication strategy with the employee along the lines of, as a manager, what do you need to know from them? And are there ways that they could periodically update you without you having to bombard them with phone calls? Can you set up an agreed schedule of calls or feedback process so that you know, obviously you're keeping in contact with them to make sure they're okay from a health and well-being perspective. But if you're a manager, you may well need updates on projects or pieces of work that are ongoing. I certainly wouldn't be comfortable leaving contact with an employee any more than a period of a working week. I would say, as an absolute minimum, we should be in touch with them in that within that week period of time. But yeah, you are right. It does need to be balanced with that potential for adding stress. Certainly, there's a surge, or appears to have been a surge, according to the media reports that I've been reading, of employees complaining of micromanagement in the situation of home working. I.e., the manager may well have just checked in with them a couple of times a week when they were in the office, but now they can't see them. There's a panic. Trust is obviously really, really important with your teams, and agreeing that communication strategy with them, Gary, is really important. Okay, so just got time for, I will just do one last one. It's from an anonymous attendee, and it states, what view are the HSE taking now of stress at work, and are they changing their approach? It's a really interesting question, and it's one that when we kicked off the year with our annual health and safety webinar on client update, is one that we included as part of that back in January. Obviously, with mental health and stress at work being increasingly prevalent, the HSE take a view that wherever possible, while stress is a workplace hazard and should be risk assessed, there should be policies and controls in place. Wherever possible, they don't choose to directly use the Health and Safety at Work Act, where there might be other legislation or regulators that would actually tackle the issue better. So the example I'm giving there is that the source of stress may well be an employment issue, or it may well be a bullying, harassment issue, which would be better taken outside of the HSE's enforcement vision and enforcement view. They have outlined some key criteria in which they will investigate and will look in further, but it appears to me, looking at their approach, that they're quite hands off. They don't see necessarily the Health and Safety at Work Act as the primary piece of legislation to be enforcing management of stress at work. They have stated, though, that where there's clear and obvious ill health resulting from the mismanagement of the workplace hazard of stress, and that it affects numerous people, and that issues have been raised with employers and not adequately tackled, that they may look at the wider organisational aspects and could, in theory, prosecute in light of those findings. Okay, I hope that answers the question for you there, anonymous attendee. Okay, so I am going to wrap things up there. I think that's been a really good session for me. Thank you very, very much for all of your questions and your contributions. And I look forward to hopefully seeing you on one of our future webinars. Thank you very much. Take care. Bye-bye.